Vaccinations and deworming are essential components of responsible pet ownership, forming the backbone of preventive health care for dogs and cats. By understanding the importance of each, as well as the recommended schedules and practical tips, you can help ensure your pet's well-being and give them the best chance at a long, healthy life. Let's begin by exploring vaccinations. Vaccines work by stimulating your pet's immune system to recognize and fight off specific infections before they have a chance to cause harm. For puppies and kittens, this protection is especially crucial. They are most vulnerable when their maternal immunity begins to wane in the first weeks of life. For dogs, the core vaccines recommended worldwide generally include protection against parvovirus, canine distemper, adenovirus, also known as canine hepatitis, and rabies. These diseases are highly contagious and can often be serious, if not fatal. In addition to the core vaccines, there are non-core vaccines, such as those for leptospirosis, bordetella, and Lyme disease, which may be suggested by your veterinarian depending on risk factors like lifestyle and geographic location. Typically, the vaccination schedule for puppies begins around 6 to 8 weeks of age. The initial series involves multiple vaccinations, spaced about 3 to 4 weeks apart, continuing until puppies are roughly 16 weeks old. This schedule allows the immune system to build a strong and effective defense. The rabies vaccine is usually given at about 12 to 16 weeks, as per local regulations. After the initial series, booster shots are usually administered at 12 months, followed by regular boosters, often every 1 to 3 years, depending on the vaccine type and your veterinarian's guidance. For cats, the core vaccines include protection against feline calicivirus, herpes virus, which causes feline viral rhinotracheitis, panleukopenia, and rabies. Non-core options, such as the feline leukemia vaccine, may be recommended based on lifestyle. Like puppies, kittens should begin their vaccinations at about 6 to 8 weeks old. Boosters are typically given every 3 to 4 weeks until about 16 weeks of age, with rabies usually due by 3 to 4 months. Feline vaccines also require a booster at 1 year, then at intervals your vet deems appropriate. It's important to note that vaccinations are not a one-size-fits-all prescription. Your pet's age, breed, health status, and risk exposure all play into which vaccines are necessary and when. Always consult your veterinarian to design an individualized schedule, rather than relying solely on generic recommendations. Now, let's turn to deworming. Internal parasites such as roundworms, hookworms, whipworms, and tapeworms are more than just a nuisance. Left untreated, they can endanger your pet's health, affect your family, and sometimes even threaten human health through zoonotic transmission. Puppies and kittens are particularly susceptible, often acquiring worms from their mothers or through their environment. A common recommendation is to begin deworming at 2 weeks of age, with subsequent treatments every 2 weeks until 2 months old, and then once monthly until 6 months old. Adult pets should typically be dewormed at least 4 times a year, although your veterinarian may tailor recommendations based on lifestyle. For instance, pets who spend a lot of time outdoors, hunt, or are exposed to other animals may need more frequent deworming. Regular fecal examinations are a good companion to scheduled deworming, as they help identify the specific parasites present and confirm that treatments are working. Always use medications as prescribed. Improper or excessive use can foster resistance or be ineffective. And don't forget environmental control. Prompt removal of feces, maintaining clean bedding, and managing fleas can dramatically reduce reinfection and safeguard your household. By staying informed and systematically following vaccination and deworming schedules in partnership with your veterinarian, you can help ensure your furry friends remain happy, safe, and healthy for years to come.